Hello everyone and welcome to this week's edition of Let's Talk Shop. My name is Debbie DiMartini, certified clinical thermographer with Thermal Body Scan in Santa Cruz. And today I want to talk a little bit about breast examinations. There's a few things that people need to note and certainly participate more in. First and foremost, you want to make sure that every woman after the age of 40 especially, but even younger women depending on family history, you need to be conducting annual physical breast exams. So what I mean by that is an annual physical examination by your physician, in addition to routine screenings, an anatomical study such as an ultrasound, breast MRI, or mammogram, as well as breast thermography to locate any activity that may be going on in your breast tissue. But specifically what I want to talk a little bit more about today is breast self-exam. What we're seeing is studies are showing that less than 10% of the population of women are doing their monthly breast self-exams. Ladies, I caution you about this. No one is going to know that your breast tissue better than you. Your doctor doing an annual physical exam isn't going to know if that's normal for your breast tissue. Breast tissue varies widely depending on age. Some is more fibrous. People complain of lumpy breast tissue. As we age with hormonal changes, the breasts become a little more fatty and less vascular. So depending on your age, where you are in your menstrual cycle, all of these things you need to take into consideration. An annual physical exam by a physician, he's seeing 5,000 patients a year maybe. He's not going to know your breast tissue like you. So with breast self-exam, the thing to think about is that you want to do it about 2 to 3 days after your period is over. The only reason that they suggest that is that that tends to be a time during your menstrual cycle that your breast tissue is less tender and painful, so you're more likely to get a more thorough exam if you're not feeling sore. Additionally, there's some different techniques that people recommend for breast self-exam. One of the things that you need to be checking for is just looking in the mirror. Stand in the mirror with your hands on your hips, and do you see any dimpling? Do you have any, obvious from left to right asymmetry, meaning that things don't look even from left to right? That doesn't, of course, include people who just are naturally bigger or smaller on one side. I'm talking about things that look abnormal and not normal for you. Additionally, you want to check to make sure that you don't have any nipple discharge. Most nipple discharge does tend to be hormonal, but that's certainly a red flag that you would want to alert your physician about. Most women are familiar with the lying on your back with one hand behind your head and doing your breast self-exam this way. That's a great way to do it. Additionally, a lot of women actually like doing it in the shower. The reason for that is that with the wet soapiness of the shower condition, it does make it a little bit easier to move around the outside of your breast. The skin doesn't get in the way as much when you've got that slippery surface. One of the other things that you want to make sure that you're doing during a breast self-exam is you want to make sure that you are flexing your pectoralis muscles, so your chest wall muscles. So putting your hands on the hips, you kind of push forward with your chest wall. And again, make sure that things don't dimple or contort in a way that looks abnormal for you. Any of these signs that I've talked about are things that you would want to alert your physician about. 80%, ladies, of breast cancers are still found by the patient. So I cannot stress enough how important it is to know your breasts, to check them often, once a month, and if you have any abnormalities or concerns, lumps, you need to consult your physician. I urge you to get more information online. There's tons of information and charts that you can look up online about how to do and how to perform a monthly breast self-exam. For more information about thermography and its benefits, please visit my website at www.thermalsc.com. Thanks again, and I look forward to talking to you soon. Bye.